It's your chance to ask anything of the doctors tonight on Call. Funding for On Call with the Prairie Doc is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Aberdeen Asthma and Allergy, Brookings Health System, Dr. Mark Bubach with Dakota Allergy and Asthma, Dakota Care, Dakota Dermatology, the Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, and Swiftel Communications. Closed captioning for On Call is provided by the generous support of Avera, the Brookings Health System, and Fishback Financial Corporation. It is time to let you at home pilot our show. Call in your questions on whatever health topic you want, because it is Ask Anything when the doctors are on call tonight.
Hello and welcome. We're excited to have you join us tonight, and as we open the 13th season of On Call with the Prairie Doc, we sincerely thank everyone who helps to make the program possible, the underwriters, the production staff, the SDSU students who help here in the studio, our dedicated board of directors, but most of all, you, our viewers. We're here to give you information designed to help you stay healthy. We welcome your questions by phone and email, and we encourage you to visit our website, oncalltv.org, for helpful tips. Tonight, we're graced with the Drs. Falkenberg. One of your favorite returning guests, Dr. Joy Falkenberg, serves the Custer area as a family practitioner, and she truly understands rural medicine, and so does her sister, Dr. Jolene Falkenberg. With the help of Joy and Jolene, we will hope you will take away a better understanding of the safety on farms and ranches, the special concerns and opportunities of rural medicine in the South Dakota School of Medicine's rural farm track for students, and the importance of staying active throughout your life, no matter what your profession is or where you may live. So we will answer your questions as they are called in. Should there be more questions than we have time to answer during the show, we will continue live streaming on the internet after the show in our after hours portion of our evening. Call us at 1-888-376-6225 or email your questions to oncalltv.org. Well, good evening and welcome, Joy and Jolene. Thanks so much for joining us. Tell us a little bit about yourself, Joy. I'm going to start with you.
Well, we grew up in a ranch outside of Edgemont, South Dakota, between Edgemont and Harrison on the Nebraska, Wyoming, South Dakota border. And I've pretty much been with Jolene my whole life. Grew up with her, obviously, and then we went to college at the University of South Dakota. She joined me after a year at Creighton University, and then we went through medical school and residency training at Rapid City Regional Hospital, and now we practice in Custer. I'm losing Jolene to Lusk, Wyoming. She's going to be a frontier medicine doctor.
So tell us a little bit about that. What's bringing you out to Lusk, or what's that whole story?
Most of it is locale. I've ranched for the past 5 years closer to home. When I initially got married to my husband, we ranched with his parents on the Pine Ridge Reservation, but I now ranch with him just south of my dad, and so it takes me about an hour and a half to get to Custer every day, which was fine. I was used to traveling. We've traveled a lot ever since we were children, but when my children entered school, I missed taking them to school and picking them up and being involved as a parent, and Lusk is only going to be about a 40 to 45 minute drive, and they need a physician. They've had a lot of instability with physicians and medical practitioners over the years in the clinic setting, so I hope to offer that to them.
So you're going to split up finally.
Yeah, that's going to be really hard, really hard.
Yeah. Well, sisters that get along, actually. I mean, didn't you ever have fighting and,
No.
Nothing bad.
No, people ask us that all the time when we work together, and when she came to work there, they kind of said, we're a little concerned about this. I'm like, we never fight, ever fight. And it just works out. We're a little bit like twins in that we just know how to move together, and it's kind of like a choreographed dance. I mean, even with our patients, we know what the other one's thinking. I can tell you what she did 2 days before, she did it, and she can tell you what I'm going to do when somebody comes in, what I'm going to say. That's going to be hard to replace.
Yeah, well, but you'll be closer to your kids.
Well, and I still like to convince her that by the weekends I don't want to drive back up to Custer. So I'm hoping that I'll actually come to see her more often on the weekends now that I'm not taking that drive every day.
Yeah. And you're on the ranch too?
No, I live outside of Custer, near Custer State Park. So I'm only about 8 minutes from the hospital, but 4 sides of Forest Service and right next to Custer State Park, and some really great hiking and biking. So it's great for me.
Oh, this is a good place. So how many people are in Custer with you right now?
We are so lucky. We have 4 doctors when Jolene leaves. We had 5, now we're going to have 4. And actually we picked up a doc from Hot Springs that just works in Hot Springs, Dr. Heather Proust. She's awesome. Dr. Lisa Brown, who used to be in Hot Springs, then moved to Tennessee and now came back up to Custer. Dr. Terry Graber's been there the longest. Dr. Waddell joined us from Rapid City's residency program. And we have Zach Peterson over in Hill City's clinic. He's a PA, and we are so blessed to have so many good providers in that area. I mean, Custer's only 2,400 people.
But you serve probably how many people totally?
We think around 10,000. It goes into Wyoming and then some down into Nebraska, but over to Hermosa and even on the outskirts of Rapid City. So it is a pretty big area.
And Custer's part of the regional health program.
Because we grew up in that area, the people from Crawford and Lusk and even Shadron's area know Jolene and I, and they travel quite well for medical care. And they mostly want to know that somebody knows who they are, knows their name, they walk in, and so we have a really big draw area. Dr. Waddell even goes over to Newcastle now. So.
What is Dr. Waddell's first name?
Heath, Dr. Heath Waddell.
So there's a Eric Waddell from Wyoming that I know of. Is he related? Do you know?
No, Dr. Heath Waddell is from Cheyenne, but he was over in Australia and then had to come back. And of course, because the way the program training doesn't correlate, he had to actually go back through residency. So we're lucky because he's really trained up, but he's double trained.
So here is the question. People wonder, well, the big city hospital is where the care is. I mean, that's where all the specialists are. That's where all of the high technology is. And what do you think the comparison? I mean, you're probably going to answer. Of course, it's very good in the rural area. What do you think about the quality of health care there versus rural?
I think that we can still offer most of the services that people need. Truth be told, technology has probably changed medicine for the worse in some cases. I thought about that last night when I had a woman who was really sick and came in with a distended abdomen and clearly had a perforated bowel. When I walked in the room, I knew that's what she had. And to spend the time to put her through the CT scanner to verify the surgeon needed to see her and take care of her was unnecessary. I did a plain film, I did a lateral decubitus film, and it was evident, and she went to the surgeon immediately, and that is precious time. She was septic and hypotensive and very ill. And so I think we provide really good care in that setting, whether it be emergency department setting or clinical setting. And honestly, we pride ourselves in Custer to manage all conditions. If we don't take care of it, it's probably going to go to Mayo. We certainly, if people need stents or other cardiology interventions, they're going to follow with a cardiologist. But we manage all diabetes rather than sending them to endocrinology. We like to believe that endocrinology is reserved for Addison's or Cushing's or rare endocrinological problems. We really pride ourselves in trying to manage all medical conditions rather than turfing to the specialists.
And you know this, but 90% of all medicine occurs like right here. You listen, and through being a good listener, you diagnose the patient. If you jump to a CT scan, you actually probably did the patient a disservice. You need to listen first to be a good clinician, and that's what we're really good at.
Oh, it's music to my ears. I mean, I'm as a mature doctor who, I remember when the EMI scans were first done, which was electrical musical instruments who backed the first CAT scans. And I was on neurology when Emory got the first EMI scan, and then it turned to CAT scans. And we were making the diagnoses before we had those tests, and now we depend more on the technology, not enough on taking a careful history and doing an exam, and we're missing things.
Right.
And we're finding incidentalomas,
That cause
incidentally.
problems.
Right, we found this, now we got to work it up.
The classic incidentaloma story is the radiologist who had a total body CAT scan, didn't have any problem, right?
Right.
Oh, there is a mass in his liver and a mass in his lung. It must be cancer spread to the liver. Well, we'll have to do the biopsy of the lung first. So they biopsied the lung collapsed.
Right.
Then he had a chest tube, he was sick as all get out, and then about, maybe a month later, he went back to surgery to get the liver biopsy done. He bled. They had to take him to open surgery.
Yeah, right.
It was all benign
Both
disease.
negative.
Yeah, and all unnecessary.
Yep.
Which is what's important, that we communicate well to our patients, not just that I'm the doctor and you should listen to me, but to give them statistical data that supports our decision making, and not the concept of I'm going to listen to Oprah or Dr. Oz when they tell me that it's most appropriate just to have a full body scan. We want to present appropriate clinical evidence-based medicine to our patients so that they trust in us to make the right decisions for them.
Absolutely.
I had a patient not too long ago who had abdominal pain, went to the emergency room, had a CAT scan done, and they said, well, your abdominal pain is probably not dangerous, and the white count was okay, and you're an older guy, but you'll be fine. So the next day he comes back, and I examine him, and he's got rebound tenderness, and he needs to have his appendix out. I mean, it was an appendicitis. Right. So they did I sent him to the emergency room, and I said, call the surgeon, take out the appendix. And the surgeon came, and of course they had done another CAT scan. The CAT scan basically said it was negative, so they sat on him until the next morning, at which time the pain was worse. They took him to surgery and took out the appendicitis. Clinically, I think we forget how important that clinical exam is and that clinical history is, and that's just the modern technology that costs. Here is $4,000 or $5,000 worth of testing, and it was misleading.
I think it's also the helpfulness from the patients in a rural area. We, especially growing up in Edgemont, we know a lot of the people that come through our doors, and we share them as physicians. And if some 70-year-old rancher presents from Edgemont who hasn't come in 2 years and says he has chest pain, we really understand that we take that quite seriously. They don't seek out medical attention on a day-to-day basis. So
that's what my students always say. They are refreshed by the fact that when they come to our practice, that you can walk in the room and say, this person has this, and they never are in here. And you just know them. That he doesn't look right. He looks pale, or he looks this, or we need to do something different. There's something here.
Right. So it's important that we take the history, we do our exam, and then we can do the technology. When I spoke of that particular case of the appendicitis, I have to say that the surgeon is a fabulous surgeon.
Right. Sure.
But the choice was balancing. Well, I can't depend on that. I mean, we have to use a balance of both of those things, right? So it is a balance. Things are harder nowadays. So before we go into our break, but we have to make sure that people know that we're looking for them to call us. We will take your questions. But the next question I have is to do with hog wrestling. I've heard some rumors about hog wrestling, and I thought maybe, are there good hog wrestlers in this country hereabouts?
I'm sure what he heard, was that you and I were the best, and that Jody was kind of the weak link.
Yeah.
Oh, yeah, is that right? The other sister?
Yeah, the other sister, the ranch sister. We have to kind of, help her along.
Oh, is that right?
Actually, I better correct that, or she probably will beat me when I get home. Jody is the link.
Right.
If Jody's on the team, we win. And
is that right?
We're just mostly for fluff.
I would have actually desired to have retired years ago, because I can't.
From the hog wrestling?
Yeah. It's really a young person's sport.
Is that right?
I'm a person of maturity as well, and I'm ready to be done cleaning mud and other particulate material out of my hair and ears. But she was pretty insistent that we try to give it another hurrah this year. So she went with her two daughters,
Josie and Julie.
Yeah, to the Edgemont or Fall River County Fair, and they won there. And then when she came, and I think this was a complete setup. I told her I wasn't going to do it, and when she showed up there, she said, "I didn't realize that they already entered us. They've Calcutted us." And so her daughter and Jody, we won. Yeah.
But nobody else was you're competing against hardly anybody else, right?
Oh, there's quite a few people out gunning for us.
They take it pretty seriously.
But make sure you introduce us right. We are the world hog wrestling champions,
yeah.
not just the local world.
Okay,
Right.
I got that. In urban hospitals and care centers, there are often specialists and an array of test equipment to aid a doctor in diagnosing a patient. But in rural areas, Doctors need to know how to help and heal without the fancy tests and equipment, and are often on their own when a patient presents. When medical students train in small towns and clinics, they are more likely to practice in a small town or clinic and serve the needs of the whole community. My alma mater, the University of South Dakota Sanford School of Medicine, offers students the opportunity to learn in a small town across South Dakota through the Frontier and Rural Medicine Program, or the FARM program.
There are several states that have rural tracks. Probably the granddaddy of rural tracks is the RPAP program, which is in Minnesota. So we know that other states have had successful programs and have placed a lot of their eventual graduates from their residency program back into rural communities or into their rural track communities.
Of the students who graduate here, if you look at them after they've done their residencies and settled down, 40% practice in the state of South Dakota. We have a large interest in rural medicine in our class, and if we train students in an urban environment, sometimes they lose their footing on what would a career in rural medicine really be like, or what types of resources would I have, or do people really like it? And therefore, we started the Frontier and Rural Medicine program, which is where 6 of our students spend most of their third year in a town of less than 10,000 in South Dakota.
Walking down town, everyone knows me practically already, so I feel kind of bad. I don't know everyone's name yet, and they're like, "Oh, how's it going?" Remember everything. I'm like, I should know you. I've talked to you, but I really like that. My wife loves it, so I think it's been a great experience on that front. I'm trying to attract more patients, and it's, I think, easier to do out here, where, if a patient comes in, it's a lot easier to go down the hall or across the street, and hey, instead of across town, and giving you that more full experience where you can track patients and that continuity of care. And I get to see a variety up here. I'm the only student, which I think is a benefit, where I get to hop in over on surgeries, or if there's a cool case down the hall, they come and grab me. And they've all been great. The nurses, doctors, everyone's always, "Hey, this is going on, where's Nick at?" And
we select them well in advance. We do that for a number of reasons. One is because we want them to get to know the community, start to form a relationship, so then when they get to the community, they can hit the ground running. We also do it because they have to do a community project, something that's specific for the community, and something that is substantial, whether that has to do with patient education or some unique need that the community has. So we want them to have time before they're actually there to think about that project and start to develop that.
I'm working with Brock out of Sioux Falls. We're going to try to start a HOSA, or future health professions group up here throughout the school to get the students more experience to healthcare and careers within it, and just build leadership and everything within the community.
We are always interested in having more students stay in South Dakota, and we want them to fill the need areas according to what their own calling in life is.
This year is the first year of the University of South Dakota Sanford School of Medicine has had the opportunity to offer the Frontier and Rural Medicine program. Jolene, have you heard of programs like this? And as a rural doctor, what do you think this program will be?
I think it'll be absolutely imperative to return young physicians back to rural areas. The only reason that we probably exist where we do is because we came from there. And the only way you're going to expose young people to be excited about working in a small town is to actually let them be there when they're young in their career. So often young physicians are new in life and they're unmarried, and you don't want them to go to a residency in Chicago and establish a family and be involved with someone who they've established roots now in a city. If they can do that in a rural town and understand that it's a great place to raise their family and live, then you've been ahead of the gate there.
One of the reasons we got involved in medicine is our oldest sister, Joanne, is a family medicine doctor, and she works at Palo Alto now. At the time, she was in residency at East State Tennessee University, and it was so cool to get to go and follow her around, and she showed us so many great things. We went to Omaha and visited her at UNMC. She got to take us into some of the anatomy labs, like all kinds of fun stuff. And she was probably thinking more about medicine, but I was just pretty much thinking about my social life, and then it made me start thinking more about it.
So, I mean, but
a mentor. She was our mentor.
Where did, and of course, mentorship is where
Sure.
it's all about. I mean, and unfortunately, people go to a residency somewhere and their mentors are specialists.
Right.
And so to get an idea of to going into primary care or family practice, you've got to have a mentor. You know, older sister, maybe a hero like Dr. Bell from DeSmet, like me, or some kind of person that you look up to and you go, that's what I want to be.
I absolutely agree. Heather Moline and Ann Grady are two of the students that are coming up. Ann Grady is a fourth year now, and Heather Moline just graduated. Just top-notch students, and one of the things that they talked a lot about is how being with a strong female role model in a rural area made them feel like they could do anything. They could handle it. They could do anything they wanted to, and I think that is just really, really important.
What do you think about women in medicine at this point? I mean, you know, I remember when there was three women in my med school class of 55, I think. And it has changed to 50-50 now. I mean, it's kind of back and forth, but it's right at 50-50, which is what it should be, I think. But at the time, I was reluctant because it changes, because women, you know, we always had because women, and there was a million things.
I think there's a lot of statistics showing that there's more women in rural with primary care, right, than men. So I think that they even gravitate towards primary care a little bit more, maybe because historically it was hard to get into some of those specialties if you were a woman, but also partly because they're, by nature, a lot of women are nurturing and they like primary care, you know. I do know that it's hard to have a family life, pregnancies, and a practice. But I think it's like anything else.
You did it, though.
Sure, and if you invest in women, you know, even though they may take maternity leave and things, they're such great long-term workers that they're wonderful. I don't think it's completely equal in the boardrooms yet. I think that has ways to come yet.
There's a glass ceiling of some kind.
Yeah, and I think especially in our area, you know, we're able to relate because we came from a rural area and we grew up on a ranch, and so, you know, we do a lot of the things that some of the rural people do, like probably curse more than other women and some of those things, but also
rope and ride.
Ride
Chew tobacco. Four-wheelers. No, not so much there.
We could support young children to not do that, but I think you'd be surprised by how many older ranchers come in to see us because they really feel that we pay attention to them and listen to them, and they're men that you generally wouldn't think would come to see female physicians, but they're very comfortable with us, and we have open relationships with them, and I think there's a lot of female physicians, even in urban areas, who can establish a good personal relationship with their patients.
You know, and I wanted to ask you, before we dive into questions, the issue of a spouse, the spousal issue. How did you two feel about your spouses? You know, I think sometimes there's that feeling that the guy doesn't necessarily want to marry a strong, dominant, powerful physician woman kind of person, because guys need to be the macho, you know, type of.
Yeah, both our guys get called Mr. Falkenberg sometimes. So
Yeah.
both of our husbands are incredible fathers, and obviously we gravitated towards people that we knew would make good partners with us. And that means if we're gone, they're changing diapers, they're making meals, they're taking kids to events. My husband recently got a judgeship, so that's going to be a lot different for us. He was home with the children, and then he took a part-time position as a deputy prosecutor. But you know, Jolene wanted her kids to grow up on the ranch and be ranch kids, and
that's what they're doing.
Absolutely, you know, absolutely. And Brian's an incredible husband, father, supportive.
He's cowboy through and through.
I mean,
he packs those kids everywhere.
I just met Brian, and I thought, cowboy.
Yeah.
Weren't we going to talk about ranch accidents in a little bit?
We need to talk about ranch accidents, but let's take some questions from Rapid City. What are your thoughts about the closing of the VA in Hot Springs?
I think it's probably been decided. I think it's very important that people put up the fight and try to ask questions. I worry that sometimes when the government is involved, there's always been decisions made by the time they come and have some of the organizational meetings. So I'm worried for it. It's not as though it doesn't exist. It is a true concern, and I think
you would like it to stay open.
Yeah, I think it would be a grave loss to that community for jobs, for productive citizens, for really great people who make that community live. And it's a service to a huge area. I have people who come all the way down from Sydney, Nebraska, I mean almost to Colorado, to come to that VA. It serves a huge area and does a good job at it too.
The downstream economic revenue that VA has is incredible. I mean, we are very concerned for Hot Springs if the VA closes. And quite frankly, taking elderly patients out of their community to drive to Rapid and say, it'll be okay, you know, there's going to be a Rapid City clinic. Well, how do they get there? How do they afford the gas? You know, how does that work? But we're very concerned about it.
All right. How bad is it on your health to be involved in spraying weeds with weed killer of any kind?
I get to answer this one because I'm kind of an anti-pesticide, I'm really...
You like the natural way.
Yeah, I mean, I garden, I grow fruits and vegetables partly because I don't want to go and get something out of the store that may or may not be sprayed with something. I think that it's really important to be careful. It's a chemical, you know, if you breathe it in, if you have it on your skin, there's going to be ramifications from that. So, I mean, I think it's important to take precautions about that. Yeah. I actually had a case of a gentleman that stopped at one of the rest areas, ate an apple, and clearly there was some type of organophosphate on it, and came in, and we had to actually do a full all-out resuscitation on him. And that was
from the apple?
From the apple, from eating like 2 bites of this apple. He did okay, but it was spooky.
Ooh.
Yeah.
Jolene, this one, discuss bipolar disease. What is it? How can it be treated? It's a good question.
Yeah, bipolar disease is complex. So there is a large book that patients may not know about called the DSM-4, Transition to the 5, and it has a diagnosis set for multiple psychiatric diagnoses. So when you meet certain types of criteria, you will fall within the category of major depressive disorder, bipolar disorder, even childhood diagnoses like oppositional defiant disorder. I think sometimes people think, oh, you kind of seem like this, when really there's specific criteria. I believe in bipolar disorder. I think, unfortunately, it's very trendy right now when people actually truly do not meet the criteria, because there should be some mania criteria with different traits within bipolar disorder. And I think what people need to understand about psychiatric cares is that we still try to manage it similarly, okay? So if you have depression or bipolar, we're still going to choose drug classes that work as mood stabilizers or antipsychotics or what you need. And most importantly, psychotherapy and behavioral modification. I have so many people who come in with psychiatric concerns who really want a pill to fix it, when it's a lifelong changing process to change the characters within ourselves that may not be perfect all the time. Right. We've got to work on that.
Multidisciplinary approach, especially in these communities where, you know, you may not have a lot of therapy and things, but there has to be a multifaceted approach to it.
And I think people need to understand that we are not good, okay, myself in particular, I'm not a good psychotherapist, because, you know, we come from a place where we pull ourselves up by our bootstraps and go out. And so to come into an office visit and expect that I will spend 20 minutes counseling you, I'm a prescriber of medication, so I can manage your conditions in some ways, but you really do need to see a psychotherapist too.
And I have to add, and should start an exercise program, because that's part of it.
Absolutely.
It's so important for anything.
Right.
According to the Center for Disease Control, in 2012, 374 farmers and farm workers died from a work-related injury, resulting in a fatality rate of over 20 deaths per 100,000 workers. What are some of the most basic practices that we can use to minimize our chance of injury or death on a farm or ranch?
The past 40 years, the National Safety Council has ranked agriculture in the top 3 continuously every year as being one of its high-risk occupations. As a result of that, we put a lot of emphasis on agriculture and the risks associated with this occupation, and trying to make people aware of the risks and also taking preventative measures. Even though this population still represents a small portion of our total population here in the United States, less than 2%, either in owner-operator or employee on the farm, like I said, they still have a large risk And the other step that oftentimes we forget is actually watching our employees and watching them operate it, critique them, and going back and retrain them if they're not operating that equipment properly, or our family members and so on, so that they do not become injured. The next step in the process is actually to make sure that we are physically ready to operate that equipment and to work in the environment that we do on a daily basis, especially when we come into high stress seasons such as fall harvest coming up. Within our equipment, it's a really good reminder before we start with our fall harvest here to take a second, check your fire extinguishers, make sure that they've been fully charged up and are in working condition, especially in our combines and tractors as we go out to the field, because, like I said, it's very easy with the grain dust and wind situations and you know, parts moving on that equipment to have a spark and to start a fire. And so having that equipment readily accessible can help sometimes to prevent fires getting out of control and things burning. So take the extra time and check that safety equipment. Along with that, having access to a first aid kit readily on the farm, or even carrying one in your equipment, is advisable, so that, you know, if you do get some cuts and scrapes, and you can properly clean them and take care of them in a timely manner so they do not become infected and result in a bigger problem down the road.
Well, there's no question about the value of safety and
Right.
precautions about, you know, on the farm in particular. But please call in your questions about anything rural health or city health or anything. 1-888-376-6225, or email us on ask@oncalltv.org. So, comments about safety in the farm or the ranch.
We've had our share fair of accidents actually on the ranch. Our nephew went over on a four-wheeler, I don't know, 3 or 4 times, and he knocked his teeth out, broke his jaw, had a massive laceration through and through.
And you were the ER doctor.
Right, and I was the ER doctor, and yeah, that's spooky always when it's your loved one. Her husband just went over with a cold.
Yeah, and he had a bad goring injury when my child was
right.
about 6 months old that about killed him because
Cow
it was
gored
by
him.
his femoral vessels, and she put a horn in him, and he lost about 2 feet of colon, and had a helicopter trip for that. And those are things you may not be able to prevent, although I remember, which I appreciate about his personality, I remember him telling me, he said, it was the neighbor's cow, and he said, I've known that cow forever, and she's blind on that side. I should have known better. So it's kind of interesting that he felt bad about it. But on the same side, you know, what I see, especially because he not only cares for my children, but he cares with them and does all of the tasks of ranching. So there's a lot of new interventions that safety equipment that is offered. And I'm not talking about putting a helmet on your child, because you can't do that all the time. But for example, he can lock the dashboard on his tractor so that if my 3-year-old's sitting in there with him and he has to get a gate, there's some safety interventions you can practice. Yep. And I think the importance of farm and ranch safety is just training your children from a young age. Even though they talk about the first aid kit, the one thing that I think is really important that young people learn from being around life and death on the ranch is to not panic.
Do not panic, yeah.
So something's bleeding, let's put some pressure on it. Or how do you call 911? At a young age, my children have known that, even though they knew that I was around sometimes too. But I think all of those things are taught over the course of time, and it has to be preached day in and day out of how to stay safe, not having excessive speeds on ATVs and motorcycles. You know, our horses, my husband's always been a good cowboy and broken colts, and our kids always understand that you walk your horse around. You don't go right to loping. They need to be broken into and understand to be safe too.
Don't go directly into loping, I'll remember that.
Yeah, you know, like with Joel, he had to remain calm. He was bleeding all over the place. He had to turn his 4-wheeler back over.
He had to go find help.
He had to go find help, you know. And so same with rattlesnake bites, same as, you know, all these, Jake.
What are you doing with rattlesnake bites,
You know, we don't keep venom, anti-venom, because it's so expensive, and Hot Springs does, because they get so many bites down by Angostura. They just had a rattlesnake bite again last week, and so they keep anti-venom. We would send it right to regional where they have anti-venom there. Yeah. But you know, if you're out on a ranch, stay calm. Go to the nearest, you know, help. And I think actually it's important to have your GPS coordinates. Even if it's not, you know, close, know what your GPS coordinates are for the main house, because these are long distances. If you're waiting for Edgemont's EMS to drive all the way out on gravel and drive you all the way back, that's probably not a real great thing. Either get in the car and go, scoop and go.
Yeah.
or call Lifeline, or scoop and go and call Lifeline and have them meet you. That's what we do all the time.
Right.
Jake Thompson, our nephew here, he runs a baler, and he talks all the time about how when he gets out of that baler, he shuts it down because it can just suck you in so fast. One piece of loose clothing, I mean, yeah, it's
and
really...
you're bailed.
You're bailed.
Yeah, the interesting thing is, even though we talk about equipment or horses or motorcycles, probably the most important issue for farm and ranch safety with children is always teaching them to buckle up from a young age. You know, even my children get used to riding around in the caking pickup in the wintertime, and if you practice that loosely, they don't understand at a young age to always, oh, I'm right in the vehicle, I need to buckle up. And probably it's the most common injury we see in the ER is young drivers at a fast speed who roll a vehicle and are ejected because they didn't have their seatbelt on.
Four-wheelers.
Yeah.
Four-wheelers, buckle up on a four-wheeler.
No, just slow down on your four-wheeler.
We are not
Slow
the people to
down
ask
on
about
it.
helmets.
Okay,
we
no.
didn't really grow up that way. But
I got a call. What percentage of people in their 60s get a shingles shot? What reasons are there for not getting a vaccine? Shingles shot vaccine.
I don't know how many people get it, but they should get it. And
the only indication or contraindications to getting the shingles vaccination is to have an immunocompromising illness such as HIV, or to be on immunocompromising drugs like the biologic injectable agents for rheumatoid arthritis, prednisone at chronic high dosages that can suppress the immune system, because it's a live vaccination and thus can cause complications.
And it's not 100%,
It
but
isn't.
it does ameliorate shingles that might occur.
man, if there's anything you can do to prevent shingles, right?
That is a
oh my
tough
goodness,
call.
what a terrible
Take care.
disease process.
I mean, how many people have you seen that have, no matter what you do, post-herpetic or neuralgia, the pain that follows shingles? And
Rash
that
goes
just
away, but the pain stays.
stays. So, and the question is, when do you get the shot again if you've already had shingles? I've heard 1 year.
I think the Merck representative who comes to see us is very capable, and she always tells us that per their instructions, it's somewhere within the 6-month time period. They don't really like it administered any sooner because they think there's still active antibodies within the system. But it is important that people get vaccinated after they've had it, especially if you have it at a young age, 30s, 40s, your chance for recurrence is higher.
So there's a lot of fear about vaccinations in general.
Oh, yeah.
Any comments the two of you have? You have any fear about giving vaccinations?
No, but we have a ton of people in the Custer Hot Springs area that do not vaccinate. And what I tell those people is, first of all,
You're wrong.
Right, but we want to work with them. We want to work with them. We do not have a policy that if you don't vaccinate, don't come to us. In fact, our policy is if you don't vaccinate, please come to us, because we want to explain it. We want to work with you. If you want an alternative schedule, it's not ideal, but if that's all you'll do, we'll work with you. We want to vaccinate your kids. But medicine has kind of done this a little bit to themselves. This thing they did with HPV, where the political groups got involved and they were talking about mandating, and then the public doesn't trust you as much. We should stick with what we know, which is medicine, and we shouldn't get into the political parts of this. We shouldn't be in the back pockets of anybody.
Absolutely. There you go. The caller's young daughter has environmental allergies. Everything she takes, any antihistamine, she breaks out in hives. What can she do to help her daughter? She also has celiac disease. So anything she takes, she breaks out in hives, it seems like. Hive condition. Hives is a very complex disease.
It is, yep.
It's more than what we think it is. We used to.
Right. It seems odd that somebody would have an actual allergic reaction to an antihistamine.
I don't think
so.
that's-
I don't think that's what she's saying. But most allergic and hive conditions, we try to help with antihistamines, and they have, the leukotriene inhibitors with Singulair. And so I have 2 people with chronic hives, and they just get them, but we've reduced the amounts of times that they get them, and then when they get them bad, we actually have to put them on some prednisone.
Yeah.
But now the allergies, it's interesting, now they're saying expose your kids to more allergens and they won't be so allergic.
That's right.
Yeah.
We
don't
put them
have
on
any
a
allergies.
ranch, get them exposed
Yeah.
to all that
Have them eat
dust,
some
hog,
dirt.
have them eat dirt.
Yeah, we ate a lot of dirt.
Farms and ranches can seem like magical places, especially for children, but there are many potential dangers that families need to contend with every day and find ways of keeping their children safe when their parents' attention may be focused on the chores at hand.
Farm safety when you're trying to raise a family on a farm is important every day, all day. As a mom, I'm worried about everybody that's outside on the farm.
We teach our young kids to respect the large machinery, you know, not go near it by yourself if it's running, wait for an adult. Stay in if they're riding with us, stay in the cab, don't touch anything. We shut the tractor off when we get out, so they're, you know, and kids are curious, so they're going to get off the seat and they're going to push buttons and whatever. So anytime they're with us and we get out and they have to stay in, then we just shut the tractor off.
And if you ask our son, he'll tell you, I can't ride in that tractor because it's not safe. He knows what's safe and what's not. We also try to make sure there's designated areas on the farm for the kids. They know that grass is a safe place to be. They know that if they go off the grass, there should be no running equipment. They know that when they go off the grass, they probably should have an adult with them, or they know that when they go off the grass, somebody should be watching them, because that's where farm equipment is. That's where cars are coming and going, and that's where it's just not as safe. We do have a designated play area on our farm that is fenced in, and the children know that if they're in there and the gates are closed, that that's a safe area. Safe from equipment, safe from animals, safe from everything. And as a parent, I know that if the children need to be somewhere while we do something shortly, and we can still see them, and you know, they're in our bird's eye view, that they can be in that area and it's safe for them. And it's fun. It's a play area to keep them busy while they're safe. They're swinging, they're playing in the sand, they're having a nice time.
Kids can move around. I always look around when I'm running around on the yard with a piece of equipment just to see where the kids are. Katie and I are always in communication. Hey, I let the kids come outside, so you need to watch out for them. Or if I'm coming home from the field, you know, I don't know if they're outside or not, so I slow down when I pull in the yard. We usually keep a gate between us and the cattle when the kids are with us. That way, there's no way that we can get hurt.
Typically, we have another adult watching them for us, but there's that moment there, you don't have another adult, so we make sure that they're in a pretty safe spot.
Even for an adult, you know, like during harvest time when you're pushing and you're trying to get done and something happens and you're like, well, I'll just leave everything engaged and go fix this problem. And all it takes is a split second.
Or I'm tired and I'll just go for another couple hours because I can finish it. It's not worth it. It's not worth it. There are days we probably could get stuff done a whole lot quicker, but when you try to be safe, we know it's the better option.
Right.
Well, that was the Vanderwalls, you know, and Katie is regularly on this show as a dietitian, but she's also a farm mom, and the idea about keeping on the grass is a great idea. Any other comments that you have?
Yeah, I think from a very young age, even before they could speak, we talk to our children about if a vehicle's coming toward you, you go away. You don't think that they see you, and you run toward dad when he's pulling in the yard or something, and you don't step behind vehicles. There could be someone in it. And the same thing with horse safety. You don't go behind a horse. You don't know other people's horses. They may not be as rideable as you think they are, and to trust in our guidance about that.
And gun safety. I don't think we've mentioned anything about that. You know, we talk to the kids all the time about not touching guns, and parents about putting their guns up appropriately. But a lot of times on a farm or ranch, there is a rifle around to shoot a coyote or to shoot varmint, and children need to know they never touch those guns, that you assume that gun is loaded and ready to go.
Yeah, good points. Here's from Custer. What do you think of the sweeping changes in medicine toward electronic medical records that take time away from their patients? Maybe one of the patients who watched the time that's being demanded. What do you think about EMR?
It's terrible. It's distracted doctoring. It is no different than driving in a vehicle and texting at the same time. The idea of multitasking is false. You cannot multitask. You can pay attention to one thing at one time, and then you can direct your attention completely to something else. I think that it's going to be important in the future that as more doctors are employed, it's going to be a model that the organizations have to have scribes, or they have to have somebody that takes the secretarial work off the doctor, so that when I walk in, I look at the patient and I listen to them. And we're in this transition time, and it's a terrible time right now to be in a transition, not just for regional health, but for everybody using an EMR.
Right. We have Meditech. You have Meditech.
We have Athena in the clinic.
Yeah, it just doubles the time.
It does.
Oh, absolutely.
And I think the hardest part too is just you're trained differently, so there's disorganization in my brain of to where things are in the chart. And so fortunately I can know a lot of my patients, but if I saw a patient of Dr. Graber's or someone else in the clinic who came into a walk-in visit, and I'm trying to find something that's pertinent in their medical history. I'm not sure where to even go compared to where I was on a paper left side of the chart that the big things were right there.
There it was.
It's a little bit
How to
frustrating.
pronounce their name.
Yeah.
Written
Yeah.
up in the corner, draw a picture.
Yep.
Those are gone.
The initial studies show that it's not as safe as they thought too, and that errors occur in electronics just like they occur in paper. So yeah,
And
it'll
I'll
be
be
a
curious
changing.
to know how medical students do learn over the course of time, because now I have a drop-down menu that actually shows me a medication dosage. So I feel like it dumbs down medicine to protocols a little bit. You know, I had multiple drugs memorized in my head for years, and now actually as people come out of training, I guess they won't have to do that.
Oh,
as
but
much.
I
don't
leaned
know.
on my my handheld Hippocrates
Yeah.
computer for doses. I will say this: there's some really good things that happen. I mean, you do have quicker access to flow of labs. You don't repeat labs when you've already seen. You can see some things that are really. I think there's some advantages. We're in the transition time, as you
Right.
say, Joy.
At some point, somebody's going to say, this has to all communicate. I think there's new information saying that, and I know that Regional Health is working on something, a crosswalk, so that they communicate. But right now, it's no different than it was on paper, where you have a technological EMR here that doesn't communicate with your EMR here, so that part's got to be fixed.
Our hospital has the same electronic medical record as the Avera Systems Hospital, and our clinic has that same system.
Right.
But our clinic, owned by the Avera, doesn't communicate directly with the hospital because you don't want to share those. We've got to do better in that. That's just outrageous.
Because it's for patient safety.
Discuss Graves' disease and what is it and how is it treated?
Graves' disease is related to hyperthyroidism or having an overactive thyroid.
Or both, right?
Right.
Like you can turn it on, turn it off. Antibodies.
Yeah, so there's antibodies within your system that cause the thyroid levels to go up, which will cause typically symptoms of a high heart rate or anxiety-like symptoms, maybe heat flashes, those type of things. Unfortunately, Graves is not easily treatable. It's not as though you can typically give a pill. They do have some forms of pills, but I have not seen a lot of efficacy with that. So the most common modalities to permanently treat it is to either cut out the thyroid or perform radioactive iodine ablation to kill the thyroid tissue, and then you're stuck on thyroid supplement the rest of your life.
And there's also the ophthalmologic things.
Yes.
Tell us a little bit about that.
Complications.
Yeah, you can have proptosis where your eyes bulge out.
Bulgy, yeah.
Yeah, and if you wait too long, you know, these are the
that can be
things, don't ignore stuff like that. If you wait too long, we can't ever take the proptosis away. It's like you walk around with bulgy eyes the rest of your life.
Yeah. So, very interesting condition, but pretty darn rare, really.
Yeah, and treatable.
Hypothyroid, low thyroid, is very common. I
common.
think, what, 20% of the people that you take who are over.
It's a lot.
But probably overly concerned by the public, I believe. I mean, the thyroid is still a small organ, and I'll have so many people come in with probably depression or other things going on in their life, and they'll either have some weight issues or they're fatigued for other reasons in their life, like stress, and they want me to do a thyroid test,
it's
which I'm
not
glad
the-
to do, but it's not always the thyroid.
It's easier
rarely.
to take thyroid medicine than it is to go jog
Yeah.
or walk or stop eating so much.
This is for Jolene. Since you are moving from Custer to Lusk, what differences in rural health do you think you will see?
Yeah, Lusk is a smaller community, more rural community with very large frontier sort of medicine, as we call it when we categorize medicine, wide open spaces. I'm actually doing all the same things I do in Custer on a smaller scale. The whole county, Lusk being the primary town in the county with the school, is 2,400 people. The town is around 1,400 people. So I'll still practice.
That's a great sized town, actually.
Great, yeah. We'll practice in the clinic, the ER, the hospital, and so they still have all the services. Smaller bed hospital, of course, I think only 4 inpatient beds. But that's actually what I love. I love to be able to see people and care for them and get to know their community. And it'll be very similar, just a different scene. But it's hard.
people.
It's hard as a transition to leave a great community, a
And
good
your
sister, and
family.
a great colleagues who have been supportive.
That's right.
That's going to be the hardest thing, is not having your other colleagues, because
And really super, I gotta say, I mean, really the best nursing staff you could ever
Oh,
have.
yeah.
Very knowledgeable, both clinic and hospital.
Well, I thought the nursing staff in Brookings was the best.
Oh man,
you
you
guys are probably.
yeah, they babysit us all the time. They're very, very good people.
Well, how chronic back pain? You've got 10 seconds to answer chronic back pain question. I think we'll move on.
Don't get
We'll answer these
surgery.
later.
Try to avoid surgery.
Try to avoid
Yeah,
surgery.
perpetual.
We'll be back right after this. As we begin our new season of On Call with the Prairie Doc, we would like your feedback to help us do a better job of producing the kind of informative program that you deserve. When you call in or email with a question, we will invite you to take a short survey in the next few days at your convenience. This is your program. and we want to make it better with your help. In over 32 years of practicing medicine on the prairie, I have seen a lot of changes in healthcare, some not so good and some good. Not so good begins with the electronic medical record, or the EMR, which has such potential, yet has so far been a disappointment. The EMR seems developed mostly to satisfy billers and defense lawyers, and at this point provides too little help with actual caring for the patient. The myriad versions out there do not interact well with each other, and because of user not so friendly EMRs, it's just about takes twice the time to see a patient now. Hope springs eternal, however, and a much faster, easier to use, and more communicative version should be evolving in a couple years. With all the modern advancements in technology, I believe there has been reduced emphasis by clinicians on taking time listening to the patient's story, laying on of the hands, listening with the stethoscope, and actually examining the patient. I know our med schools are trying to fix that, and I personally think just maybe we do that better out here in rural places. Also not so good, I've watched how obesity, weakness, and diabetes is on the rise, possibly due to appliances, vehicles, labor-saving devices that have been making life too easy. And to boot, I believe we in the medical profession have too readily moved to emphasize a pharmaceutical treatment while not encouraging our patients to exercise enough. Some are critical of the move to physician assistants and nurse practitioners, but I believe that individually, any one of them may be a superb and intuitive healer. After all, when any clinician is greater than 5 years away from medical school or training, one is only as good as how much she or he reads, questions, thinks, and most important, collaborates. Changes that have been good include all the same technology I discussed earlier, the tremendous improvements in diagnostics with CT and MRI scans, rapid laboratory testings, and revealing genetic analysis, or in advancing pharmaceutical therapy for cancer, depression, esophagitis, hepatitis C, and hypertension, or in surgical therapy with vascular stents, endoscopies, and robotics. The list goes on, but we are light years ahead of where we were 32 years ago. And these advances are almost as readily available to us in rural America as in the big city. The biggest challenge in the years to come will have to do with financing all of this. And I predict will result in even more changes. Let's hope they are good. Okay, 15 seconds each person. Final words.
Go.
Jolene.
Because it's my last opportunity to have a public broadcasting moment with my sister, I have to tell her what a substantial difference she makes in my life daily. And I appreciate everything the Custer community and all of the Custer staff has done for me. It's a new experience. It'll be hard for me to leave, but I'm glad there's a new town who gets to utilize my services too.
That's great. And that's all you have to say, and we thank you.
I love her.
This brings us to the end of our show this evening. I sincerely thank our fantastic guests tonight, Jolene and Joy Falkenberg, for helping answer our audience questions this evening. As often happens on the show, time ran out and we didn't get to all your great questions. So to hear our answers to more of these questions, please join us now on our website, oncalltv.org, where we'll continue live with On Call After Hours on the web just in a few minutes. In a jump on the bandwagon moment, I have agreed to do the ALS Ice Water Challenge.
Oh, no.
However, there is one stipulation. I will allow myself to have a bucket of ice water dumped over my head if we can get 25 people to donate for ALS. To do so, go on our website, oncall.tv.org, and click on the donate button and follow the instructions to donate whatever you choose to donate for this great cause. All of your donations will be forwarded to ALS Foundation, and I'll risk hypothermia.
Make sure you tell our dad we love him. We love you, Dad.
You will have 1 week to do this, and if you reach 25 of you, our faithful viewers will see me on TV.
Nice.
So we'll results next show. I can feel it now. So we end tonight with a reflection from naturalist Aldo Leopold from his touchstone writings in a Sand County Almanac. There are two spiritual dangers in not owning a farm. One is the danger of supposing that breakfast comes from the grocery, and the other that heat comes from the furnace. Until next time, stay healthy out there, people. Hello and welcome to On Call After Hours, where we answer some of the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, and we want to answer as many as we can for you. So there was the question about obesity epidemic, diabetes problems that we're having in the U.S., and addressing the question about labor-saving devices. Do you think that's the reason? What is the reason for obesity in the U.S. and South Dakota in particular?
Well, I think we get busy with our jobs, and it's, our jobs are tiring even though they're sedentary, and so people come home at night and then they tend to be sedentary even more. I think television is one of the worst things that has changed imagination in children, obesity in adults, and just, you're right, being active, growing our own food, not just in a rural area, but so have an herb garden outside or do something else that you can do that's productive.
And sometimes people are so protective of children that they don't let them be children, run around and play tag and jump on a trampoline, for example. I mean, do something.
Devices.
Yes, there's too many electronic devices. I think processed food has a huge impact too. Macaroni and cheese is not a staple for your children.
Okay.
You know?
Okay.
Especially when you heat it up in the microwave.
So, my sense is that the earlier we get our kids active, the better it will last for their whole life.
They learn it.
They learn it. And you said a lot of the ranchers are skinnier guys, and farmers are getting heavier because they have so
I didn't
much.
say that.
Oh,
Just kidding.
you had said that. You said that. I'm sorry.
They're all slim and beautiful.
They are. Those ranchers are, and the farmers. Some of them are real slim and
They have to
beautiful
sit in a
too.
tractor all
They're in
day.
their tractors.
Yes.
But that's it. I think we need to try to, whoever it might be, whatever job it is, you need to be physically going hard 30 minutes a day.
Well, and if you have a sedentary job, so be it. The majority of Americans do. But then you need to dedicate at least 3 to 4 days out of the week. And I have so many people come in who are frustrated by their inability to lose weight. And so I ask them, what their exercise regimen is. Oh, I walk. I'm like, no, you need to reach a target heart rate. You need to do that for an extended period of time, for 30 minutes at a time. You need to actually sweat. You should require a shower after exercise.
When we think about just movement, how many people do you have that come in and request a handicap parking sticker who really, you want them to walk more, not less?
Yeah. We have a caller from who had a email, actually. What are the newest ways to treat osteoporosis as we age? What is your opinion of the injections used for treatment, and what are the side effects? So the treatment for osteoporosis, I'm going to start. Walking, exercise, that's way better than any of the pills. We have been emphasizing medicinal therapy. I don't prescribe it personally.
We prescribe it some, but I would like to see that we are actually working on that bone health from square one. We reach our maximum by that time we're 35, 40. Well, what are you doing to build your bones to age 35 and 40 so when you go through menopause, you don't get osteoporotic? And I'm kind of with you. I think that that's going to be that area where...
We don't know what we're doing with the first groups at 5 years, and it worries me that there's an injection now. What do you think of that?
We're giving Prolia. Yeah, we like it. I like it better than the bisphosphonates in general.
I think in general the mechanism of action and the studies probably show maybe a little bit more benefit, but I agree with you. I don't think we have enough long-term studies to prove certain qualities of the drug and how long, how long do we use it for? Do we give a drug holiday?
I have to say too that I think the information on hormones, I think that those studies were a little bit flawed. I think people got very spooked about estrogen, and I'm not sure that I don't reach for some estrogen replacement therapy before I actually look for an osteoporotic medicine. If hypogonadism is the problem, I kind of look towards that first, actually.
Well, and I'll say it one more time before we move on, and that is that bones are made strong by the walking and the weight that we do, and they get weak if you go into space or if you sit on a couch. One or the other. You know what I mean? What are the newest? Okay. Can you discuss hyperparathyroidism and what calcium supplements help or hinder?
Hyperparathyroidism usually is detected by high calcium levels, and so you wouldn't want to take calcium levels for hyperparathyroidism. It's opposite direction. So the times when I see hyperparathyroidism, typically probably same with you, is kidney stones. We always look, when you have multiple kidney stones, we look for I do have 2 cases of hyperparathyroidism. We have a parathyroid in the mediastinum, and we'd have to go in through a mediastinoscopy and open this area up and pull it out. And so we actually just deal with the high calcium levels, and we're not going after that because the person's elderly.
Yeah.
So
And
lots
renal
of different
complications
things.
too.
Right.
Renal or kidney complications will lead to a change in the parathyroid function as well.
It's the weirdest deal. They pull the thyroid back. There's these 4 little buttons. They take the right number, and because sometimes it's all 4 of them, or sometimes it's 1. Yeah. And then to make sure that they haven't destroyed them, they'll take a little bit of parathyroid gland and implant it in their forearm. Mm-hmm. And it's evolving, this whole thing. We sit on people with hyperparathyroid a lot and don't do anything because sometimes it's just a little bit of it.
That's why we need people like Dr. Palmer and Dr. Rebus.
Yeah.
Endocrinology.
That's when I send in for the endocrinologist. How can chronic back pain be treated? Is there such a thing as killing the nerve to decrease the pain?
You hit the nail on the head when you say walk, 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 lose weight. First of all, prevent back pain by being physically fit, having a strong core, and not just waiting for the back pain to occur.
The core is that whole trunk. It's the back muscles, the side muscles, the belly muscles. That's the core.
Yep, and it's one of the number 1 money spenders for healthcare costs is back pain, and it's partly because we're out of shape, we're not physically fit, and we get overweight. Now, other people, once you have back pain, then physical therapy is a mainstay of treatment, massage is a mainstay of treatment, treating the musculoskeletal system. Then there are some pharmaceutical medicines that can help for it. Back surgeries can help with it.
Injections.
Injections, and finally a rhizotomy in some cases. But I'll tell you, when you start getting more and more surgeries and rhizotomies, how many times do you see it work real well?
I actually have never seen a rhizotomy work, and it's cutting that nerve to kill the nerve pain, and the pain continues. Pain is a more complex thing than we think we know.
And I think that's the hardest thing, which is an important topic we probably talk about, is narcotic utilization, whether it be for back pain or other problems.
Shoot, we're going to do a whole show on the narcotics.
Yeah.
And actually, back surgery is not almost always not indicated by pain.
Right.
It's indicated by loss of motor function.
And we try to educate people about that when they leave the clinic, is to say, I know that what caused you to come in today is really your pain, and we'll try to manage that as best we can, but it's very important that if you have a foot drop next week, you come in to see us.
Right away.
Yes.
The narcotics, now they think they upregulate the pain receptors, so you can actually deal with less pain the more narcotics you're on. That might be shooting yourself in the foot being on narcotics.
Right. There is a lot to be said on these topics, and we can go on, and we're going to have a show on back pain. We're going to have a show on narcotics, and so we're looking forward to that. Well, we thank you both for joining us on After Hours Conversation and on call with the Prairie Doc this evening, and what a joy and a Jolene it's been.
Thank you.
Thank you. And thanks for joining us on call and being our audience. We appreciate all your questions and the opportunity to answer them. Be sure to join us next week on South Dakota Public Broadcasting at our regular time, and call in your email questions, and watch for our columns on your local newspaper. Listen to our On-Call Conversations radio show on the station near you. And until next time, stay healthy out there, people.
Funding for On Call with the Prairie Doc is provided in part by
Avera is a proud sponsor of On Call on South Dakota Public Broadcasting.
Larson Manufacturing is proud to support On Call Television as it continues to open doors for important medical information. And by the South Dakota Foundation for Medical Care, the Medicare Quality Improvement Organization for South Dakota. Additional funding is provided by Aberdeen Asthma and Allergy, Brookings Health System, Dr. Mark Bubak with Dakota Allergy and Asthma, Dakota Care, Dakota Dermatology, the Orthopedic Institute, Physicians Care Sanford Clinic Community Service Committee, and Swiftel Communications. Closed captioning for On Call with the Prairie Doc is provided by the generous support of Avera, Brookings Health System, and Fishback Financial Corporation.